If I could have it to where it's straight here and then come down a little bit. Now I understand I got this right here, but if I could have it some way like that, it'll make it easier.
I see.
For me, as far as going forward haircuts.
Hey everyone, I wanted to showcase a patient's hair transplant procedure for you guys. If you want to see the uncensored version of this video, which we don't want to show on YouTube, please make sure to jump over to my Patreon and become a member. The link is in the description below. This patient is a 24-year-old African-American man who was coming into us from out of state. Many of our patients come from out of state. And he was bothered by hair loss in the frontal scalp and in the temple area. I want to capture all of this in the transplant. But then, you know, in terms of how low and the shape, that's where, you know, I need your input. And I know we talked about slightly lowering it. Personally, I don't see any reason to go lower than here. He noticed that over the course of about 3 to 4 years, he started to have recession, started to have thinning, and he really didn't like it. And he was unable to get the shape up that he was used to getting. So he started on finasteride a few months prior to our consultation, and then had to wait several months to get on our schedule. And we discussed with him the importance of maintaining the medical therapy that he was on. And as I talked to you guys about this on the channel, it's very important to think about it as like the medical therapy is stabilizing your existing hair, and the hair transplant is building on that. If you did a hair transplant, you're not on any medical therapy, then you get continued recession and progression of the androgenic alopecia, and then it's very difficult to chase that with grafts over time. We discussed, of course, FUE versus FUT. We decided on FUE, which is the 1x1 follicular unit extraction, and this was due to his shorter hairstyle, and he wanted to avoid the linear scar that comes with FUT. In terms of the graft count, the recipient area that we had in mind was the frontal scalp, the anterior mid-scalp, and the temples. And when you're thinking about a graft count, you have to consider the overall recipient area. How big is the area that you're trying to fill? What type of density are you trying to achieve? What type of hair you're working with. It's different if you're working with finer, straighter hair versus coarser, curlier hair. You have to consider your donor supply, how much you have in the scalp, versus sometimes some body hair sources of grafts. The number of grafts that you can safely extract in a single session. And by safely, I mean safe for the donor area itself, not to over harvest, and also safe from the perspective of not making the day too long, where your team, my team, is not too fatigued, and also where the patient's grafts are not outside of the body for too long. And curly hair is particularly challenging to extract with FUE. The reason why it's challenging is because the extraction devices are straight. The actual punch is straight, whereas the curly hair is curly not just above the skin surface, but beneath the skin surface as well. There's a curl underneath, and to varying degrees, and sometimes you get even almost like a C-shaped hair. And that makes it very difficult to extract with a straight device without transecting the hair. If you transect the hair, it's not going to grow well in the new location. So the idea is to go into the skin and curve the arm, almost curve the wrist or the arm as you're going in to try to adjust for that curl, and it's going to curl to varying degrees throughout the scalp, so you're constantly readjusting that angle, and that's what makes it so challenging. So for this patient, our total predicted graft count was 2,000 grafts. Please make sure to subscribe to the channel if you aren't subscribed already. We like to put out many videos on hair restoration surgery as well as facial plastics and other medical topics, so please turn on that notification button, like, and then we love when you comment, and definitely subscribe to the channel. So let's go into the day of surgery. So in the morning, patient shows up, usually with a family member, but sometimes a friend, sometimes no one at all. So you have a seat here. We're going to do some consents. We discussed the different medications that the patient normally takes. Most people honestly don't take a narcotic, but what I'll do is I can prescribe it somewhere. When are you heading back? Tomorrow morning. Tomorrow, yeah. So we'll find a pharmacy that's like 24 hours before you leave, and I'll just like prescribe it there. Perfect. And you just go and pick it up. That's just like the painkiller in case you need it. But most people take just Tylenol, but the first evening you might take a pill or two of the narcotic, okay? So we'll try to both remember that, okay? All right, this is the only one that you truly kind of need to take. This is an antibiotic to prophylax, to prophylax against infection. And we do consents, right? There's a series of consents for the practice that are important, such as the HIPAA consent, such as consent for the surgery, and similar consents also for photography. You know, some patients agree to posting photos online and videos, others don't. We go into the marking part of the process after I've taken photographs of the patient. And the marking in this particular case took a very long time because it mattered a lot to the patient how the hairline was designed, as it should for all patients.
If I could have it to where it's straight here and then come down a little bit. Now I understand I got this right here, but if I could have it some way like that, it'll make it easier.
I see.
For me, as far as going forward haircuts.
Sometimes there's a pretty obvious pattern that you can follow based on the way that the hairs are at the time that the patient comes in. Other times you really have to design it with, like, you know, kind of a more custom approach where you don't have the exact pattern of what you want and you're just trying to create that from scratch. And it's a combination of effort between the patient looking at it many times and my sort of vision and artistry, as well as my technicians. I love to involve the technicians for the design as well, because everyone's involved in the process, and when you have really good technicians with a lot of experience, you want their input as well. So we spent probably at least 30 minutes actually designing actual hairline and the way that the temples would look, and it's worth the time. It's a very important time investment in the beginning of the case, and that pretty much sets the course for the rest of the day. So I had two wonderful technicians with me, and so once all of the marking was complete, we then transitioned into the procedure room, where we start off with shaving of the back of the head to prepare the site for extractions. It's possible to do FUE with longer length of hair, but it's much easier to do it when the hair is cut short, especially for curly hair. So once we had it shaved down to the length that we needed, which was very short, we then disinfect the scalp with betadine solution, and we then proceed to do the numbing. And sometimes the numbing is actually done before the betadine, which is fine as long as you alcohol the area first, and we numb the scalp then. And the numbing, you're going to feel it. I mean, you feel it even if you have the medications on board. You definitely still feel it. And as far as the medications to kind of put the body at ease, we give Valium and Ambien. Some people choose not to take those, but most people will take our recommendation and get that on board, as well as an antibiotic and a steroid pill for swelling. The area is then numbed, and once the area is numbed, then we size up which punch we need to safely extract the grafts. And so his donor area was the occipital and the parietal scalp, so a bit onto the side, so the back of the head and wrapping onto the side. And we settled on a 1 millimeter punch, which for curly hair is becoming more of a standard for us. Sometimes we'll go to a 0.95, but oftentimes a 1 millimeter is necessary to safely capture the entire graft. And you don't want to be transecting your 2, 3, and 4 hair grafts, so you want the punch size to be large enough to capture that, but you don't want it to be too big where it leaves a more noticeable scar. So there's always a balancing act there. So we settled on a 1 millimeter punch, and remember, 1 millimeter punch in the WA system, which is what I use, is very different from 1 millimeter in some of the other systems. The WA punch tends to leave a very small dot scar at each area. And then the total grafts, like I mentioned, we were aiming for 2,000 grafts, and we were able to obtain that number of grafts, which was great. It usually takes about 3 to 4 hours to do the extractions for a case of this size, especially with curly hair. All break for lunch. When we come back, we have to then numb the front area where the grafts are going to go. So once the recipient area is numbed and it's disinfected, then we proceed to do the PRP, which is platelet-rich plasma. We get a blood draw, we centrifuge the blood, we get the platelets, and we inject the platelets that have growth factors into the scalp. And that helps not so much with like promoting the growth of the new hair, but it really helps with preventing shock loss. Shock loss is when you do the procedure and you basically cause some local trauma to the area, and your existing hair the hair that was there before the transplant can actually start to fall out. Usually that's a temporary process, but it could still take 6 to 9 months for that hair to grow back. So that's why we like to do the PRP for patients who quote unquote need it, where there is existing hair. Sometimes you have an area where there's no hair at all. PRP is less effective in those situations. As far as the recipient area, when it comes to making all the little tiny sites or the little pores where the hairs are going to get inserted, we use these little custom cut Persona blades. And for our patient in this situation, we selected a 0.6 millimeter blade size for his single hair grafts. So remember, the grafts exist as families of 1, 2, 3, or 4 hairs coming out of the graft. So for the singles, which are the ones that we place at right at the front of the hairline, we use the 0.6 millimeter recipient blade size. And so some people ask, well, if you had a 1 millimeter punch size, then how is it that that's gonna, that graft is gonna fit into a 0.6 millimeter recipient site? And that's a great question. And the reason is because it depends on how you orient your recipient site blade site, right? So there are two basic orientations when you use a kind of a rectangular blade. You can go sagittal, which is like this, or you can go coronal, which is like this. When you make a sagittal incision, which is the way I generally make them, the length of the actual slit is about 50% on average bigger than the size of the blade, if you follow. And the coronal is more of a 1-to-1. If I make it coronal like this, a 0.6 millimeter recipient site blade is about what you get in terms of the length of that slit, 0.6 millimeters. If I make it sagittally in this direction, then you get about a 50% gain. So for a 0.6 millimeter recipient site blade, you're looking at more of a 0.9 to 1 millimeter site. And that's why it kind of makes sense when you're actually thinking about the punch size versus the recipient site blade size. So we use the 0.6 millimeter for the ones, and then for his 2, 3, and 4 hair grafts, we use the 0.8 millimeter recipient site blade. And the reason you want to match it up well is because you want to be able to lock the hair well into the site. You don't want it to be so tight that it strangulates the graft, and you don't want it to be so loose where the graft can just pop out and has no directionality. And as far as the hairline design, again, it depends on the individual, depends on what their goal is. For our patient here, he knew that when he would go to his barber, the barber was going to basically just kind of go straight across. So even if he had a scattered pattern to his hairline, where we sometimes will scatter it to make it look a little more natural, he knew that his barber was still going to basically create a clean cut. And so there was no reason to really scatter as much. So there is still some irregularity to the hairline design, which is important for creating more natural hairline, but it's not as scattered as we do for some patients where they're not looking for that kind of shape up look. So it's important to keep all those things in mind when creating the hairline design, not just when you're drawing it out in the beginning of the procedure, but when you're actually making the actual slits into the hair. So that's important, but you can still see some degree of irregularity in the front, and that micro irregularity again helps create a more natural final result. And when you're working on the temples, one note there is that you really want to angle it fairly flat to the head. You don't want to be coming at it this way. It's got to be fairly flat. Even in curly hair, where the curl sort of goes wherever it wants to go, it's still important to follow, of course, the hair angulation in the neighborhood, but know that for the temples, it's got to be angled flat to the head. So that's an important point. And the day ends up being kind of long. It's always a long hair transplant day. I mean, generally we start about 7 a.m. And if it's a full procedure, like in this case, we're looking at about a finish time of between 5 p.m. and sometimes 7 p.m. So it just really depends. But again, a lot of time in the beginning goes to just planning things out, taking the medications, doing the consent forms, shaving, numbing. It's like we only get started at least an hour after the patient shows up. So if they come at 7, getting started closer to 8, 8:30 with the extractions, finish the extractions by about, say, 12:30. Then we do the PRP and the numbing and all of this. Then sometimes we'll start the recipient site making, sometimes we'll just break for lunch. And then it takes time to actually make all of the sites. And then it takes time to place the hairs. That takes hours. So it is a long day, but generally it's well worth it. So our patient was super awesome, super gracious, and we spend like a lot of time together with the patient and the team. So there's a lot of laughing that goes on. There's, you know, serious talk. There's all types of great banter throughout the day. So it ends up being a fun day, but by the end, everyone's exhausted. The patient's ready to go. Our team is tired, but that's part of surgery. That's what it's about. But it's a great team effort. There's no surgeon out there who does all this stuff by him or herself. You require a team. The process is very labor intensive. It pays off in the end. And we'll be updating you on how this patient does in his recovery and as he starts to see the results of the transplant, which takes many months. So if you guys enjoyed this video on my patient's hair transplant journey, please make sure to check out my analysis of LeBron James. We'll post the card here and we'll see you there.
So is your hair gonna grow though?
Let's hope.
This is my doc right here.
Hey Mom. How are you? You did great.
She thinks you just did a 13-hour procedure to say, is it gonna grow?
Yeah, as long as he follows the instructions, it's gonna grow.
It's real swollen right now, but this is where my hairline probably gonna be, like somewhere right there. Once it goes down. Wait till I show you the picture before and after though.